How are the stages of cancer determined? Like, what do doctors see in a tumor that makes them go yep, that's a 4. No going back. That's all? What makes a cancer a stage 2, or 3, or 4? It entirely depends on the type of cancer. For example, see here for the actual definitions of the different stages for breast cancer. Staging is a prognostic tool, meaning it's mainly used to determine how likely you are to survive the disease and for how long. Generally, it's based on looking at 3 things: the size, extent of the tumor itself, whether it's spread to local lymph nodes, and whether it's spread to other areas of the body. As a general rule, though, stage 1 cancers are almost always just a single, relatively small tumor sitting in an organ. They're often considered curable because you can just cut them, or the organ they're in, out of the body and then boom, no more cancer. Sometimes radiation or chemo is given to make sure there's nothing left. Stage 2 and 3 are the most variable depending on the type of the cancer, but these indicate some combination of the tumor being larger, it physically growing into some surrounding organs, structures, or it's spreading to local lymph nodes. These may be curable or they may not be, but treatment will often require more than just a quick surgery and may require more intense chemo, radiation, etc. Stage 4 almost always means that cancer cells have escaped to distant organs. Maybe it's a breast cancer that has spread to your bones, or a lung cancer that's spread to your brain. At this point, the cancer is not curable, but it is absolutely treatable. Some people get very lucky and respond really well to a treatment and the cancer shrinks and doesn't come back or grow for a while. But it will always come back eventually, since there are almost certainly some cancer cells hiding somewhere. If you're lucky, it won't come back before something else gets you first. Stage 4 cancer is never good, but how bad it is depends on a million factors. For example, the overall life expectancy with stage 4 breast cancer is 3 years, but if you have the type that needs estrogen to grow, it's 5 years on average since we have more effective treatments. On the other hand, stage 4 liver cancer has a median survival of about 9 months, and with Hodgkin lymphoma 80 to 90% of people survive longer than 5 years. Blood cancers and some other odd kinds of cancers often have a totally different staging system, since there's no single tumor. So, to answer your question, a doctor usually can't just look at somebody to know, but if they do a scan and they see cancer in multiple organs, you know it's stage 4.